We are called to serve humanity.
I talk about that. Do not use cloudy or discolored liquid. Always check expiring date. I mentioned all these things. Now let's move to the next topic, which is control and high risk medication. When we talk about control and high risk medication, you are supposed to pay so much concern to a medication that are on high risk. You have to make sure you control them. Like this one, I said narcotics or barbiturates must be locked in a separate place. What you have to do while controlling such medication? You have to, number one, double check the high risk drugs. Double check them. For instance, example, anticoagulants, insulin, certain IV preparation. Then secondly, you have to administer only medication you prepared yourself. Don't administer medication that you are not the one who prepared the medication. It's going to cause problem to a patient. Now let's look at the example of those kinds of medication. If I say narcotic opiates medications, example, we mean morphine, fentanyl. What should be the harmful effect for such medication if you administered it anyhow? If you did not lock them in a separate place or in a locked place, there will be a problem. Why? Because they are respiratory depressions, they slow respiration, or they shallow the breathing easily. You see, if you keep them open, anything can happen. They cause extreme sedation, like morphine can cause extreme sedation, then which can lead to a coma to a person. Then you have to understand it's risk for dependence and risk for addiction. If somebody is addicted to taking such medication, it may likely affect him or her in their life. So you have to be very, very careful in keeping them open when you have a patient who has such medication in his prescription. Then the second one is barbiturates. Example like phenobarbital, pentobarbital. All these are harmful medications. If you are not careful, they may likely cause harm to a patient. Severe central nervous system depression. When someone has taken them, it used to depress the central nervous system easily. And drowsiness, they cause confusion, they can lead to coma. You see? So when you keep them open to a patient can take it at their own convenient time, which can be a problem. Respiratory failure, they can cause the failure of the respiration. When there is failure to the respiration, there will be no in and out of oxygen, and carbon dioxide. You see, there will be a problem in the patient body system. Then the third one, high risks of overdose and death can cause as a result of barbiturate. So you don't keep them, anywhere when you are supposed to administer them. So you have to keep them in a locked place. Then the next one is anticoagulant. Let's look at the example. Heparin, and warfarin. They have the harmful effects of excessive bleeding, internal or external. Then hemorrhage can be life-threatening. They increase the risk of shock if under or overdose. If you take them overdose, they can cause problem. If you take them underdose, they can also lead to a problem which can cause internal or external bleeding, or it can lead to hemorrhage, and this one can be life-threatening because it's giving us escape of blood. This is what we mean by hemorrhage. Now the number 4 shine ake kira insulin. Insulin is an example of drugs that is used to treat patients that have that are depending solely on insulin for diabetes mellitus. Then regular insulin, short acting, that one is also part of medication that you have to make sure that you avoid keeping them anywhere. That's why we keep them in a freezer. So the harmful effect is hypoglycemia. When some patients can take the insulin by themselves, it can easily lower the blood sugar. That is the blood sugar level in the blood. That is hypoglycemia. Sweating, tremors, confusion, coma, seizure can occur if sugar drops too low. You may see someone be pitting, he will be having seizure. When he's having seizure, so it can cause brain damage. Also, it can lead to death if untreated. So things like that, you have to be very, very careful. We have another example for certain IV preparation. Example like potassium chloride IV, magnesium sulfate. All these are medication that has some certain harmful effects. Like this one, potassium chloride KCl IV, they cause cardiac arrhythmias, they cause cardiac arrest if given too fast or in excess. If you give them too fast, like you want to inject them to IV, if you give them too fast, it will cause problem. If you give them too slow, it will if you give them in excess, it will also lead to a problem. Cardiac arrest, heart will stop suddenly. When heart stops suddenly, now pumping of blood, no circulation, you see there is a deprivation of blood supply to all part of the vital organs. Definitely someone can easily die. Magnesium sulfate, especially IV, muscles weakness, can cause muscles weakness, can cause loss of reflexes. Yes, there will be no reflex action. When there is no reflex action, definitely no sensation in the body. There is no communication between the body and the brain, that is the nervous system will shut down. Respiratory depression, it will depress the respiration. Definitely there will be problem in the taking in an air. Oxygen, cardiac arrest, or at at toxic level. When the toxic level is high, there will be a problem. So what you need to do, the control that we are talking about here, you are expected to do what? This control we are talking about, this control and high risk medication that we are talking about, these these drugs are on the high alert medication list. Yes, you have to know that the Institute for Safe Medication Practices, that is ISMP, Institute for Safe Medication Practice, they require strict double checking and monitoring to prevent fatal errors, fatal killing. That is what we mean, fatal thing, something that can easily kill. So we have to consider this one is very, very important. Now let's move to the next topic, which is patient safety precaution. Correctly identify patients. Use ID bracelet. We talk about this. Do not leave drugs at the bedside, unless approved, e.g. nitroglycerin. You have to, if vomiting occurs, after oral medication, report immediately. I'm summarizing. New orders required for surgery. So we have to talk about this. Handling medication errors and omission. Record omitted medication with reason. Report all errors immediately to charge nurse or prescriber. You have to take accountability and ensure patient safety. These are very, very important. What do you have to go home with in your back as a student, or in your brain, or in your memory, or in your medulla oblongata, or in your number 6? These are the things that you have to go home with. Safe medication administration is essential in nursing. Safety precaution protects both the nurse and the patient. Yes, you have to understand. Documentation is an important as administration as well. Follow the rights and right principles. The 6 rights, which we said sometimes they are also up to 11 rights. So the 6 rights and the principle you have to follow it strictly. Nurses play a vital role in preventing errors. So try as much as you can always to prevent or to avoid errors while administering medication. Now let's look at the drugs types. This is our another new topic to discuss in this video or in this lecture. Drugs types and descriptions. Yes, 1, we have medication that are aerosol, spray, or foam in nature. These are medicine in liquid. These are medicine in powder. These are medicine form that is what sprayed on the skin using air pressure. You use to spray on top of the affected area. Example, we have deodorant spray, we have wound spray. All these are example of aerosol spray or foam medication. Then the second one, muna the types of medication da ake kiran su aqueous solution. They are aqueous in solution. Then this one we have them you may see them aqueous solution, one or more medicine dissolved in water. These are the medication that used to dissolve in water. Example, we have normal saline with a drugs added. Like if you add some medication, it will easily drop inside. We have aqueous suspension. These are small drugs, particles that is mixed but not fully dissolved in water. Example like antacids, antacid like magnesium hydroxide. These are some medication that are called aqueous suspension. So we have aqueous solution, aqueous suspension. Then we have caplets. This one is solid medicine, capsule caplets. This one they ask. We have capsule, we have caplet. So this caplet are solid medicine that shape like a capsule, but they are not capsule. But that one, they are smooth and they are coated, so it is easily to swallow when you are taking it. So paracetamol caplets, you understand. So we have capsule, a soft container that is gelatin that hold medicine in a powder, liquid or oil form. This one is a type of medication that are in a soft container that they actually use what they actually hold. They are in powder, they are in liquid, they are in oil forms. So capsule ne amma yana da wani powder ne a ciki, wani liquid ne a ciki, wani kuma yana da makamancin irin waɗannan abubuwa ɗin. So like amoxicillin capsule, kamar like fish oil, omega-3 capsule medication. We have omega-3, zaka ga ruwa ne a ciki, liquid ne a ciki. Like this one amoxicillin, kamar yanzu muka ce ampicillin ko ampiclo, zaka ga shi kuma gari ne a cikin irin su waɗannan. So these are some of the things that you need to also understand. We have cream medication that are cream in nature. These are also drugs types and description. Cream in nature, a smooth non-greasy medicine that are applied on the skin. We used to apply them on the skin. That is something about this medication. Like we have antifungal cream, Tribat, we have Tribat, we have skinal infection. All these are example of medication that are called Elixa. We have another one called Elixa, a sweet liquid containing alcohol and medicine. This one they are used to make the drugs taste pleasant. The cough Elixa, this one they are this type nature. So like we have cough Elixa. Then we have extracts, a very strong concentrated form of medicine that is made from plants or animal, like liver extracts, like vanilla extracts. We have non-medical. All these are types of extract medication. So some of them you may not see them so easily like that until maybe you grow big. As you grow in the profession, one day you will encounter such, or if you are into pharmaceutical selling medications, then you also know some medication. Gel or jelly. We have a clear jelly medicine that becomes liquid when applied to the skin. So like ultrasound gel with medicine, we have those kinds of jelly medicine that we apply during even scan. During some time, there are a lot of jelly that we normally use to apply on top of our body as a medication, as a form of medication. Liniments, a liquid medicine that is mixed with alcohol or sometimes oil or soap that is rubbed on the skin for relief. We have balm for muscle pain. We have some balm that we used to apply joint pain. When somebody is having pain on a particular area, you apply those kinds of medication. So you see that one for the skin is for antifungal. Remember this one, it may be liniments that may be applied on a particular joint, on a particular muscle for particular reason. Then lotion. We have lotion medication that are in lotion in nature, a liquid medicine that are applied on the skin to smooth or to treat conditions. Example like calamine lotion for rashes. There are some cases of rashes that we use calamine lotion sometimes for rashes. So these are some of the medication that are called lotion in nature. We have lozenge, that you can call them frog. They are plant medicine that dissolve slowly in the mouth and releases the drugs, usually like throat lozenge for cough. If somebody is suffering from cough, this particular medication are being written in or prescribed in especially at ENT. Now we have ointment, a thick greasy medicine that are applied on the skin or inside the nose or inside the mouth. We use our antibiotics ointment. These are ointment that can be used for treating some problems at the mouth, so problems in the nose. That's ENT drugs. We have pests medication that are thicker version of ointment, does not go deep into the skin, like zinc oxide, pest for diaper rash. We apply those one. Then we also have another medication that are pill in nature. Pill are small solid of medicine that are shaped round or oval in shape, like aspirin pill. We have even the contraceptive pills. All these are medication that are used. Actually, they are oval in shape. They are some round in shape. Then we also have powder medications, finely ground medicine that can be taken by mouth, or they are used on the skin. Oral rehydration salt, ORS, is a powdered medication. Yes, we also have powder. We have talc powder. All these are powdered medication that can be applied on the skin, or sometimes that can be used for medication for taking inside the body. Suppositories, a solid medicine that is shaped for insertion into the body, like rectum. These are types of medication that can be inserted into the rectum, into the vagina, or into the urethra. It melts at the body temperature to release the drugs. Example, we have paracetamol suppository. There are some medication that can be administered through vagina, through rectum, or through urethra. Then we have syrup. These are also types of medication that are a sweet, thick liquid medicine, usually to hide bitter taste, especially like cough syrup are also example. We have tablets, a solid compressed medicine that is shaped into a small disc. Some can be split in half. Sometimes this one we break them like this, we split them. Then some are coated, enteric coated, to protect the stomach. So these are some of the medication that we call aspirin tablet. We have them, tablet already. Then tincture, a tincture medicine, they are prepared in alcohol or a mix of water and alcohol, usually from plant. Then example, iodine tincture. All these are medication that are being transformed and that are being in nature of tincture. Transform patch, a medicated patch stuck on the skin. Medicine is absorbed slowly over time. We have nicotine patch. We have contraceptive patch called diaphragm patch. The women can use it to insert it inside before sex, which the medication will be absorbing through the skin, through the mucosal membrane slowly. Then we have drops. These are medication in nature of liquid from given in a small amount, like that can be dropped inside the eyes, inside the ears, inside the nose. Example like eye drops for infection. This one are medication that are called drop in nature. We have inhaler, the one that you can inhale through nose, that delivers medicine directly to the lungs through breathing. Example like we have salbutamol inhaler for asthma, for asthmatic patients. So that's why they have the inhaler, but the inhaler has something. They have the medication inside. As you spread it, you inhale it, it will pass inside through the air. We have injection, that's medicine that is given with a needle under the skin into a muscles or into a vein. Example like insulin injection, like IV antibiotics. All these medication are in form of injection. We have troch or film strip. This one are dissolvable medicine that is placed in the mouth, or on the tongue. Example like we have oral dissolving strip for nausea. These are some of the medication that can be given. We have even oral nepidepine sublingual nifedipine is also medication that are called troch or strip. Then we have emulsion, mixture of two liquids like oil and water, where medicine is suspended. Example like cod liver oil emulsion. We have such medication that are also emulsions in nature. We have fodder for reconstitution, dry fodder that must be mixed with water or saline before use. Example, we have antibiotics fodder, vial, those one, the one in vial. So this one are fodder for reconstitution. As we talk about drops earlier, ophthalmic or otic or nasal medication, we talk about that one. Liquids given into the eyes, ears or nose. Example like chloramphenicol eye drops. We have nasal decongestant drops. All of them are mainly used for ENT and ophthalmic nurses. Now there are some important points I want to lay out here, which I said: never crush enteric coated medication or sustained release tablet. You see, this one we talk about enteric coated tablet and sustained release tablet. Never crush them. Why? You will see the reason. Enteric coated tablet, this tablet have a special coated that protects the stomach, so they are designed to dissolve only in the intestine, not in the stomach. So if you crush them, by the time you crush them, the medicine touches the stomach directly. This can burn, irritate or damage the stomach lining. Did you see why you don't have to crush them? Example like aspirin, enteric coated medication. If you crush this one and you administered it just because you want to fleet patient, you have caused problem to the patient. Now sustained release tablet, let's look at. These are tablets which are made to release the medicine slowly over many hours. By the time you crush them, all the medicine enters the body at a time, at once, which can cause overdose, which can cause serious side effects and can shorten the action. Example like we have metformin, metformin sustained release tablet. We have nifedipine, XL release sustained release tablet. If you crush them, you have caused the problem. You may likely cause overdose at the time. You may likely cause a serious effect, and you cause short action when you crush them. So that is the important message here. Never crush such medication. In short term, enteric coated, they protect the stomach from irritation. If you crush them, you are improving the irritation, or you are leading to the irritation. Sustained release spread the drugs effects over time. If you crush them, you will either one, destroy the protection, or the patient may get stomach problems, overdose or serious harm. With this, you have caused problem to your patient. Thank you so much for listening. This is mark the end of our first lecture video on drugs administration. So as you can see, I remain Preceptor Fashkar on this. This is mark the end of our first lecture video on drugs administration. So as you can see, I remain Preceptor Fashkar on this particular class of FON2.